We know that Labor's obsession with net zero means that they will justify anything in the name of cutting down emissions. You name it, they're on the case. And today we discovered that this also extends to our health sector. Yes, we're told that healthcare accounts for roughly 5% of global emissions, with most major developed countries committing to decarbonising the sector. Though details remain scarce as to how you'd pull this off, of course, because how on earth are you going to decarbonise a sector on which people rely literally not only for their quality of life, but to keep living? Well, that's not stopping the Labor government. We read in the Daily Telegraph today, the Albanese government has committed to releasing a healthcare system decarbonisation roadmap in 2025. But researchers have warned there are potentially hidden costs right through the healthcare supply chain. Yes, we can imagine so. According to analysis by the Menzies Research Centre, switching a majority of Australian asthma sufferers to more environmentally friendly inhalers alone would cost taxpayers and patients more than $100 million extra annually. What are these new inhalers going to do? Are they going to be made of cardboard? What are people supposed to do? The article goes on to detail, thanks to this research done by Menzies, that even if they changed half of the 15 million inhalers purchased annually here in Australia to the more expensive, lesser emissions inhalers, that alone would cost $124 million. But of course, that's just going to be Labor playing with more subsidies, more of our taxpayer dollars, just handing them out like freebies. Joe, we have to have lost our minds when we're talking about not only this, but they're talking about we've got to reduce the emissions that patients and doctors use up visiting each other.
I think if there was any area that you were going to make exempt from carbon reduction targets, it would probably be life-saving medical care. I think maybe that's the one to say, you know what? We'll just focus on the cars. We'll just go with the EVs. We'll get a solar-powered plane. You doctors, you just do whatever it takes. You can just do it. I mean, paper straws are bad enough. Imagine a paper Ventolin. That's not going to...
It's going to get pretty
soggy. Come on, man. I think this is crazy. I think it is one of those things. I was reminded of an event I went to many, many years ago, and a very worthy event, fantastic event, about raising money for basically community housing and, extremely low-cost housing for people. And they were trying to raise money to put solar panels on the roof so that the electricity bill would be cheaper for the... And I kind of just thought, you sort of get it. Like, I could see it makes sense. I could see it sort of was going to be cheaper and everything, but this didn't look like a homelessness initiative anymore. It looked like something else. And I feel like this doesn't look like a healthcare initiative anymore. It looks like something else. I think just let healthcare do whatever it has to do to... care for people's health. The clue's in the name.
Yeah, and it's kind of essential.
If you want to decarbonise other economies, transport, fossil fuels.
No, they won't stop.
Energy,
they won't
whatever.
And for the sake of just 5% of global emissions, Kel, this is nonsense, and there is no way to do it without making healthcare less affordable.
And possibly less efficient. That worries me, I've got to say. As an asthmatic, I've got to tell you, Ventolin is not destroying the global climate, right? They're tiny little inhalers. You take minute little puffs and they'll find something which they think is fractionally better. My worry is it will be fractionally less efficient. So there'll be some asthmatics who'll be lying on their bed gasping, and people will be saying, no, it's all right. You're gasping, but you're good because you're saving the planet. You're a wonderful person.
They'll be emitting less CO2, the asthmatics.
And when they die, you find people will emit very little CO2.